So welcome, Maria, to Bill MacPhee's Recovery Blog.
Thank you.
And let's talk a little bit about your study and your work.
Sure. So we wanted to sort of explore why our patients, schizophrenic, bipolar, and depressed individuals, are using marijuana. And then once we looked at why they use it, we wanted to see if there's any connection with how severe their symptoms are when they present into the inpatient hospital.
Okay. So you had a series of questions. First of all, how many people were in the study?
So this is an ongoing study. Right now, the data that we analyzed, it was 53 subjects.
Okay. And was there a combination of male and female?
Yeah, male and female.
Male and female. And was it 50-50 as far as the male and female, or do you recall?
I don't recall.
Okay. Okay.
Yeah.
So then basically what you did, you had these 57 people, I think you said, fill out a questionnaire, correct? And what were some of the questions on the questionnaire a little bit?
So some of the questions looked at why they used. So we asked them, did they use cannabis to treat their depressed mood? Or did they use it to calm their mood because they were too hyperactive? Or did they use it for fun? Or were they not quite sure why they used it?
Okay.
And then after we looked at that, then we asked them some things about their depression, and we rated that. And then we looked at some of their levels of activity, were they sleeping at night, those things, and how frequently they were using cannabis.
Okay. So in general, how frequently were they using cannabis then?
Well, we looked at an overall scale in terms of severity. I don't know the exact numbers, but what you can say is that those that are using it more have more severe symptoms. More severe symptoms.
Okay. Yeah, and so you have that. And what was the other question? Well, a major question on there for recreational. Some were doing it for recreational. Some was doing it for medical. Some was doing it for fun. And so what conclusions did you come out with? What are the conclusions?
So what we found is that people use it obviously for different reasons, and that people that suffer from schizophrenia and people that suffer from bipolar use it for somewhat similar reasons. And they all scored pretty high in terms of using it to treat their depressed mood and using it for fun. The people that suffered from just depression on their own didn't use it as much to treat their depressed mood. And then overall, when we looked at all of the subjects, those who used the cannabis to treat their depression were using cannabis more frequently, had more agitation when they presented in the hospital, and they had more severe depressive symptoms as well as manic symptoms.